Hey there, future nurses. Welcome back to Nurse in the Making. Today, I'm going to talk all about the new NCLEX. I've gotten so many questions from students asking about what this new NCLEX entails, so I figured I would do the research for you all so you don't have to, because I know, well, you're busy in nursing school. So the NCSBN stands for the National Council of State Boards of Nursing. It's a long word, but these are the bosses when it comes to the NCLEX. They're the ones who actually make the NCLEX and put it on. So they recently announced that they're going to have a new and improved exam coming. They're calling it the Next Generation NCLEX, NGN. It's obvious to say that a lot of people are confused, annoyed, and just unsure about what these changes will look like. So I asked all of you on my Instagram what questions you had about this new NCLEX, what it entails, and I got a ton of questions, so I'm gonna answer them all now. So the first question is, when is it starting? So basically, when does this apply to you? And that's obviously a question you're asking yourself. Am I gonna take the old NCLEX, or do I need to know all the new information for the new NCLEX? So this new NCLEX, stated by the NCSBN, won't take effect until earliest 2023, which is over a year away. It's still in the research and developmental phase, so if you're going to take the NCLEX before 2023, you don't need to worry about this new NCLEX. Now, if you're taking it after 2023, you still don't need to worry, but this does apply to you. The next question is, are there written questions? So basically, it's a mix of questions. You'll see a lot of questions that look similar to what you've already been learning in your med-surg class and seen in current NCLEX review book. So let's go over these new question formats. There are 5 new types of questions. The first one is called extended multiple response. This is basically like a select all that apply questions, but there are more answer options. So in a typical SATA question, you have 5 options. So I'm guessing when they say more answer options, they mean that you could have 6, 7, or even 8 options. But a good thing, in my opinion, is that they've added partial credit scoring. So 1 point for every correct answer, but of course you lose a point if you select an incorrect answer or if you don't select a correct answer, where before it was correct or incorrect. So in my opinion, this new partial credit scoring is a benefit for you guys. The next new format is called extended drag and drop. This is really similar to the current drag and drop questions. Previously, you would have to use all the options given to you, but with this new extended drag and drop, not all the response options are required to answer the item. It's kind of like similar to SATA questions, but in drag and drop form. Not only do you need to know where they go, but you need to know which options apply and which options don't. So let me show you an example of this new drag and drop. The nurse prepares to insert an indwelling Foley catheter in an elderly male client. Arrange the following steps in order the nurse should perform them. So it's going to give you a list of steps, and you may use all of them, or you may only use some of them. So like I said, you have to know the order of it going in, but you also have to know which ones in that option may not be relevant to the steps. The next new question format is called close. These are drop-down lists. You have to select one option from each drop-down menu. These drop-down menus can be used in a words, in a sentence, or within tables and charts. You also should know that there may be more than one drop-down menu. There could be 2 or even more. So a super simple example of this would be like this question. The nurse is preparing to administer digoxin to a client diagnosed with CHF. The nurse's priority is to assess blank prior to administering the medication. The nurse knows to hold the medication if blank. So in those 2 blank spots, you're gonna have drop-down menus, and it's gonna give you, I'm not sure how many options there, but you have to choose which one is appropriate. The NCSBN didn't say whether or not they're going to give partial credit for this, but I would imagine that they would. The next one is called Enhanced Hotspot and Highlighting Items. So basically, you'll receive a case study with things like nursing notes, lab values, medication records, medical history, things like that. And then you have to highlight the findings that would require follow-up by the nurse or healthcare provider. So once you highlight it, you can unhighlight it by just clicking it and it will deselect it for you. This is the first option in those lists that's completely new. The other ones, in my opinion, were just modifications of previous NCLEX style questions, like the select all that apply with now having 6, 7, or 8 and it being partial credit. But this is the first completely new style question. So let's go over an example. It's gonna give you a long paragraph of a client scenario like in this thing. It's gonna say, basically the client's alert and oriented, maybe some vital signs and different things that the client has said to the nurse and so on. So from this scenario, what you'll need to do is highlight what is critical. What needs further intervention and action by the nurse, or maybe to even be reported to the healthcare provider. So in this scenario, we would highlight the following. Again, the NCSBN has not yet stated whether there would be partial credit given for this, but my guess is that there would absolutely be partial credit given for this new NCLEX style question. The next new question is called matrix and grid. This option, like the other one, is also completely new. So basically you're gonna have to select one or more answer options from each row and or column of the grid. So let's use the same scenario as above with our patient who just got bowel surgery. You have your assessment findings and then you have to interpret them. And your answer would look something like this. You could have 1, 2, or all options under each column under your assessment findings. Again, we don't know if partial credit will be given, but I'm guessing it will. The next question is it going to be harder than the previous NCLEX? So I really hope not. Obviously, for all of you, I hope that it's not harder, but it's really hard to tell. So on the bright side, they did say that this new scoring model will extend by allowing partial scores of items with multiple points. So in my opinion, partial credit is much better than losing all potential points for incorrect answers in the options. I'm gonna tell you how the NCSBN tries to answer this question of basically, is it going to be harder? So how will the next generation NCLEX impact the passing rate of the candidates? So they say, passing rates depend on a host of complex issues and research is ongoing. One thing that will not change is the rigor of the new exam. The new exam will continue maintaining a high level of reliability and accuracy that is expected of the NCLEX, with its standard of excellence in the regulation of nursing practice with a focus on public safety and health care needs. Basically, they didn't answer anything here. So the honest answer is that nobody really knows. No nursing students have taken this exam, so they don't know if it's going to be harder or not. They don't know if it's going to affect the passing rates or not. So the next question is, how will they grade it? The old one, you can finish with 75 questions. So again, they don't really give a clear answer, but from the explanation that they gave, I'll read it and we can interpret it together. The scoring models do not affect the delineation of the passing standard. So this makes me think that it will be the same, but again, they don't really give you a clear answer. The next question, and I got a lot of this question, will your NCLEX material still apply to the new test? Again, I've gotten a lot of questions and I wanted to clarify some of this. So as powerful as the NCSBN is in terms of determining all the details of the NCLEX, they can't change disease processes. For example, let's take an example medication from the complete NCLEX farm flashcards. Let's look at proton pump inhibitors. When I turn it around, it tells you everything about PPIs. It's gonna tell you that they're used to prevent stress ulcers, that they all end in the suffix -prozole, and over here, it says important NCLEX tips. It says that long-term use can cause osteoporosis and possibly a GI infection. So the new generation NCLEX can't change that information. They can't all of a sudden say, PPIs no longer cause osteoporosis. You need to relearn that information. This is a silly explanation, obviously, but the point is that all the knowledge you're learning right now in nursing school is still going to help you on this new NCLEX. It just might be asked a little bit differently. So absolutely, my material, other NCLEX materials out there are still going to help you tremendously with the new NCLEX. Like I said, it's a mix of new questions and old questions. So if you have an old NCLEX review book, those questions still might appear on the new NCLEX. Again, they're just gonna be some extra new formatted questions. All this can seem very overwhelming and I totally get it. So hopefully this information helps you at least know what to expect on the new NCLEX. But again, if you're taking it before 2023, you don't need to worry about these changes. For those who are taking it after 2023, my piece of advice is this. Your school is going to prepare you for these changes. You don't need to panic. Yes, change is scary, of course, but you can still become a nurse. Your end goal is still the same. You still have to take the NCLEX, it will still be hard, you still have to study. So my last piece of advice is just to keep on working hard at the task in front of you. You got this, future nurse.